If you've been following our coverage of COVID-19, you've probably seen me talking about charts like this. This shows you death tolls in various different countries around the world. The steeper these lines are, it's a logarithmic chart, so the steeper these lines are, the faster these death tolls have been rising. But to be honest with you, I've always been a bit frustrated by this because there is a bit of an undercount going on here. These aren't telling you the full story, and I want to just explain why. Looking at the UK in particular, these numbers just show you the number of people who are dying of COVID-19 in hospitals. So the latest data we have show it's 17,337 hospital deaths in the UK. But that is an undercount. By definition, that's not including deaths in care homes, in private homes. But we are now starting to get a sense of that. And this is what I want to show you, because those official death tolls aren't necessarily what the reality is. We now know that if you're going back over the course of the last few weeks, it was a very different picture when you were looking at all deaths from COVID-19, so deaths with COVID-19 on the death certificate. That's the black line there. Compare it to the white line. There's a difference there, isn't there? How much of a difference? Well, you get a sense if you look back on the 10th of April, we were told by the government back then that in hospitals, 8,958 people had died of COVID-19. Now we know, according to these new statistics, that actually the real death toll around then was 11,413. So these are deaths across the UK for all from all settings, so including in care homes as well. It doesn't look like that much of a difference, does it? But actually, it represents a 28% undercount. And if you extrapolate that out over the course of the following weeks, because that's kind of a bit in the past, you're talking now about us having a death toll that's not around 17,000. It is around 22,000 deaths, maybe even more. So those official numbers aren't telling you the full story. We now know that. And we also know that even that 22,000 might well be an understatement as well. Why? Because let's look at numbers that don't just rely on whether COVID-19 is on the death certificate. We'll look at all causes of death. And this line shows you the weekly average for the weeks of the year. So this axis shows you weeks of the year. We're now at week 15. The weekly average over the past 5 years was that if we had a real problem now, you would expect all-cause mortality to shoot up very sharply. Well, let me add the line for 2020. And well, there we are. You can see very sharp increase indeed. That is up to 18,516 deaths in the 15th week of the year. That represents what statisticians call excess deaths, about 8,000 excess deaths, so above the average you would normally have in that week of the year, 8,000. But here's the intriguing thing. Of that 8,000, 6,213 we know had COVID-19 on the death certificate, but that still doesn't explain an extra 1,783. Thousands of people are dying, in short, right now, and we don't have an explanation. We're not able to attribute it to COVID-19. It must be something else, either COVID-19 deaths that haven't been registered as that, or something else entirely. We just simply don't know, but we do know a lot of people are dying right now. And the upshot of all of that is that we have a situation now that's getting closer to unprecedented territory. Are we in unprecedented territory when you look at overall deaths in the UK? Not quite. Let me take this and get rid of that line just looking back 5 years and look back over the course of the last half century. So 50 years. Every dot on this, each of these blue dots represents another week going back to 1970. And you can see how this line compares. 18,500. Actually, it's not as high as we saw in the first week of 2000. It's also not quite as high as towards the end of 1989, a big flu pandemic then as well. And it's also not quite as high as we saw in early 1970. That was the Hong Kong flu. So it's clear that this is not quite unprecedented territory in terms of deaths. What is unusual is when those deaths are happening. They're happening in the spring. They're not happening in the winter, at the start of the year or at the end of the year. They're happening in the spring. That's very different, very unusual. And we haven't seen that before, going back 50 years at least of data. And there's the same story as well, as I was showing you, with those unexplained deaths when you look at care homes as well. This shows you the average of deaths going back to the start of the year, the first 10 weeks of the year. And again, it's a similar picture when you look at deaths in care homes. And have a look. You've got 1,500 excess deaths in care homes. How many of those are explained by COVID-19? 826, which means there is another 643 that just aren't explained by COVID-19. That's about 45% of all excess deaths in care homes don't have an explanation that comes down to COVID-19. Now, that means either we are undercounting COVID-19 deaths considerably. Even these supposedly most authoritative numbers might be undercounting COVID-19 deaths, or something else is going on. The good news is we may now be just about beyond the peak for deaths in the UK. The bad news is, well, these statistics might well undercount the reality.